Good evening, and thank you for joining me again. Today is Alicia, your lymphedema therapist at Shiloh Wellness. It's Wednesday, April 19th, and today this short video will be dedicated to Roseanna. And Roseanna has lymphedema in her leg, and I have been treating her for a couple months now. I'm out of town, so she asked me to make this short video for her to remind her of the steps that she needs to take while she's treating herself and bandaging her leg, as well as wearing a compression garment. So for those that don't know, lymphedema is not reversible. Once you have lymphedema, you have it for the rest of your life. But if you get diagnosed early, it's not so bad to manage, and it's just a matter of finding a doctor that will diagnose you correctly. So if you do have lymphedema and you catch it early, as Roseanna did, it's quite easy to manage it. And she does that with bandaging and compression garments. So what I want to remind Roseanna of is that she needs to do some manual lymphatic drainage on herself. For those of you that don't know, we have about 600 to 700 lymph nodes throughout our body, and they're primarily here in this area, in your axilla area, in your abdominal area, your inguinal area, your groin area, in your elbow here, a couple here, and then behind your knee, the popliteal region. So we all have 600 to 700. For more information on lymphedema, because I don't have time to talk about all the details of lymphedema, lipedema, edema, and all those conditions that cause swelling in the body, you can go to my website, shilohwellness.com, and there's a lot of information there that you may find interesting. So this video, like I said, is dedicated to Roseanna in Michigan. And Roseanna, this is what you're going to do. Since Roseanna has been decongested and she's been bandaged a number of times, and she now has her compression garment, but she needs to do this on a regular basis, on a daily basis. So this is what you do, Roseanna. For all of you that have gone to seen a lymphedema therapist, and they have done MLD on you, manual lymphatic drainage, but you need to do this yourself. It's a lifelong condition. So every morning, every day, you want to stimulate these lymph nodes gently behind the ear like this. And then here, you can do it with one hand, lightly, or you can use both hands 7 times. And then here in this Venice angle here, about 7 times. 7 times. And then here, you stimulate the axillary nodes. You have a lot of them here. And down here, you can do that about 7 times. And then you can stimulate the nodes there in the groin area. But what's very important, Roseanna, is to be on your back and do the deep breathing. Like we do every time I see you. You need to do the deep breathing. That is very, very important. A lot of deep lymph nodes in the abdominal area, your cisterna chyli, and you need to move that fluid up back into your heart. After you do that, you deep breathe in, you stimulate your nodes, you will apply lotion, your Eucerin or your lymphoderm on your leg, the way I taught you. Always go upwards. Unfortunately, since I'm out of town, I don't have all the equipment that I normally would use. But you would start with your stockinette, Roseanna. And for those of you that get bandaged regularly, the stockinette is a little thin one that goes on first. Then the white gauze. Then the short stretch bandages. And we start with the small one. And I believe that's 4 centimeters. And then 4, 6, I think it's 4. And then 2 of those, we start at the feet. Remember I told you, Roseanna, you do the feet. Start it with the snail, looking like a snail. That's how you begin it. 2 of those, 2 of the the 8, and I believe 2 of the 10 or 12. And then that's what you do. That's all. And then you do that every day, and you do the exercises that I taught you, and those are just moving your feet different ways, and walking, just doing what you can, walking the dog, mini squats, bending, anything you can do. But most important is deep breathing, and then of course the body brushing that I recommended. Roseanna has a body brush, and that's an excellent way to move your lymph fluid every morning upward with a brush. Of course, you must stimulate these first, and then you move with the brush each side, abdomen area, your abdominal area, the legs, all the way down to the feet, always from proximal to distal, all the way up towards the heart. That's the key, everything going back up to the heart. Because unlike the cardiovascular system, that is a closed system, the lymphatic system is not. And there's more information on that on my website if you want to go there and learn more about your lymphatic system, your wonderful lymphatic system. I never get tired, or I always remember that Psalm 139:14 is so clear about how wonderfully and fearfully we are made. And just knowing how our lymphatic system works really makes you understand and realize how amazing God created us. And so the more you understand your body, the more you understand your lymphatic system, which is part of your immune system, the more you will know how to understand the importance of exercise and eating well, getting your 7 to 8 hours a night, getting sunlight, drinking a lot of water. And so that's all for today. This was mainly for, again, for Roseanna and Shay. And so if you found this video interesting and informative, you can, if you don't mind, you can subscribe, and you will be alerted of the next video that I make. So in the meantime, be well, be blessed, and have a great and awesome and blessed week. Thank you again for joining me, and until next time.